Hello friends, I'm Dr. Rajeev Kurapati. I'm going to talk about a very important topic today. Saurav Ganguly, one of the world's most famous cricketing legends from India, suffered a heart attack about 2 weeks ago, and he was just discharged from the hospital after the second round of stenting to his heart vessels, coronary artery stenting. And the question is, how could a 48-year-old professional athlete who seems pretty healthy suffer a heart attack at the age of 48? And that too, they're saying, this is the health bulletin from their hospital, they're saying that he suffered what is called three-vessel disease, which means all the three main blood vessels in the heart that supply the heart, all the three are blocked. We don't know the extent of the blockage, but they're saying all the three are blocked. Usually, if one or two are blocked, you have what's called collateral circulation, where new blood vessels sprung up and start supplying to the heart. And so, for the most part, you can survive. A lot of people actually may have a certain level of blockages as they age, but then because of the collateral circulation, they don't suffer heart attack. But if all the three vessels are blocked, then the chance of having collateral circulation is low, and so the person might suffer heart attack. And sometimes if you have an acute blockage where the plaque, which is the material that obstructs the blood vessel, if it just quickly ruptures and acutely blocks, then there is no time for the heart to develop collateral circulation. So that's probably what he suffered. So interestingly, he was very active. He was actually exercising at his home when he developed symptoms, I think dizziness and mild heart discomfort and discomfort in his chest, when he was taken to the hospital and had an angiogram, and then when they discovered it. You see, the point of this discussion is not to pick on an individual like Saurav Ganguly, because it's not fair to pick on an individual, but the idea is when a celebrity, especially a sports person, suffers a health condition such as this, especially a heart attack, then it becomes a point of discussion not to pick on him, but to increase our awareness. For instance, Bill Clinton, when he suffered a heart attack a few years ago, there was media talking about it everywhere. And through this, a lot of awareness improved among public. And when he shifted from his diet to vegan diet, when Bill Clinton shifted to vegan diet, a lot of people were talking about vegan diet, its health benefits, and so on and so forth. So the point of discussion of this talk is not to pick on Saurav, but to use that situation, that condition, or that event as a point of discussion where we can improve our awareness. Now, you see, this is an interesting situation because he was very active, he was exercising, and he seems to be a person who maintains a certain level of exercise in his lifestyle. But when a professional athlete retires, a lot of things might change in his lifestyle. And especially for Saurav, who is active in board of cricket control. He's the president of the highest cricket board in India. He was also seems to be getting interested in politics. And so there is a whole lot of stress that's possibly playing in his life. Now, one thing we have to remember here is disease is a great equalizer. It does not distinguish between whether you are a celebrity or whether you are an actor, whether you are a doctor. It doesn't matter. If you do not have healthy lifestyle, you are at a higher risk of disease. So disease becomes a great equalizer. Now, when we look at how health conditions from healthy states to a disease state happens, you can divide it into three major categories. Of course, there are other categories, but for this discussion, I'm going to divide it into three. One is genetic. Genetic in the genetic causes, one is heritable. You can, if your parents had heart disease, or if your parents suffered from diabetes, if your parents had certain types of cancer, then it becomes a heritable. There is a higher chance of having the disease in you, and that condition is called heritable condition. The second way one develops a disease is genetic mutations. We see that mostly in cancers, where you have a genome that you did not have the disease before, and there is a mutation for whatever reason, and then you develop the disease. You see that in cancers. And the third cause is the interaction between the environment and the genes. This we call epigenetic phenomenon. Epigenetics is a newer field of genetics where the environment you live in influences your genetic code. There is no change in the genetic code, but the gene expression changes. If you look at the genetic code, it doesn't look abnormal, but the protein that is expressed from the gene has resulted in a diseased state, either the function or structure of the organ, leading to disease. So in Saurav's situation, it's possible that the environment that he is living in, it is not the people, it's the stress that's adding to it. The environment he's living in is adding to the stress. So chronic inflammation is hypothesized to be the leading cause of many metabolic diseases, including diabetes, including obesity, including Alzheimer's dementia, some autoimmune diseases, heart diseases, early dementia, arthritis, sleep. So many diseases are because of the chronic inflammation. So what Saurav has to do now is, what they're doing right now is the damage control. So he had blocked blood vessels, so they're trying to open it, improve the blood circulation to the heart. The next phase would be to recuperate the lost function of the heart, blood function and the structure of the heart. So he'll be put on a few medications to improve, to stabilize his health condition. And the third phase, which is a chronic stage, would be the most crucial, where the focus would be on stress management, focus would be on especially changing dietary habits, from eating highly refined food, ultra processed food, to more natural food, spacing out the meals, giving adequate time for the body to process it, maybe add intermittent fasting, add prolonged fasting to it. So all the things that contribute to repair and regeneration of the lost function and structure of the organs and organ systems is the most crucial step. So good luck, Saurav, in your recovery, and we hope to see you again active and functioning in your respective whatever roles you have chosen, and maybe share some of your experiences so that people who suffer early heart attacks can benefit from it. So until we meet next time, stay safe and stay healthy, friends.